Thank you for joining us at this year's National Alzheimer's Summit. One of America's great historic figures once said, "We don't accomplish anything in this world alone, and whatever happens is the result of the whole tapestry of one's life and all the weavings of individual threads from one life to another life that creates something." That person was Sandra Day O'Connor, the first female justice of the Supreme Court, who spoke at the launch of Us Against Alzheimer's in 2010, and a caregiver to her husband who died of Alzheimer's. Tragically, Justice O'Connor is now living with Alzheimer's herself. We are gathering during the most historic year our movement has ever experienced. It's a moment made possible, as Justice O'Connor put it, by the weaving together our collective knowledge, resources, and passion to end Alzheimer's. That's the power of people living with dementia and their caregivers to drive change in the world. Families experiencing Alzheimer's are the moral force for change, and change we are making. Some of the major highlights this year: FDA approved a drug that for the first time ever slows the progression of Alzheimer's. Together, we persuaded Medicare, again for the first time ever, to cover that drug. FDA also approved, for the first time ever, a drug that helps with agitation in people at more advanced stages. Medicare announced, for the first time ever, a pilot project targeted at improving the overall quality of care for people living with dementia and at reducing strain on their caregivers. And there's still more to come. By the end of the year, we look forward to FDA's approval of a second drug that slows the progression of the disease, potentially giving patients a choice of two medicines. And the NIH continues to invest in Alzheimer's research, now to the tune of nearly $3.7 billion a year. Contrast that to the world we faced when we started Us Against Alzheimer's in 2010. There were no drugs that slowed the progression of Alzheimer's. We had to fight to get people to recognize that, as my co-founder Meryl Comer likes to say, there's never just one Alzheimer's patient. This unrelenting disease takes a toll on caregivers as well. And the NIH investment in Alzheimer's in 2010 was at $440 million a year, now, as I said, at $3.7 billion a year. There was a belief that collaboration in the fight against Alzheimer's would never happen. Now our corporate roundtable, called the Global CEO Initiative on Alzheimer's, has more than 30 members driving collaboration on the adoption of new detection and diagnostic techniques in primary and secondary care, and now has a work group on Alzheimer's vaccines. And Leaders Engaged in Alzheimer's Disease, a collaborative organization we launched in 2011, has more than 100 Alzheimer's serving members. There was also a belief in 2010 that clinical trials could not be speeded up, but our spin-off foundation, the Global Alzheimer's Platform Foundation, is doing just that. What a different world we're in today, and we would not be there without your support. Now, as the title of this year's summit states, it's time to shift science into practice. What does that mean? It means we can't wait for these important discoveries to slowly, eventually, make their way to everyone. It means equipping healthcare providers with the latest information on risk reduction, early detection and diagnosis, and treatment options. It's lowering the cost and burden of obtaining an earlier and accurate Alzheimer's diagnosis through less expensive and more accessible blood and digital tools. Navigating hurdles in government policy and delivery systems in the U.S. and other countries as new treatments demonstrate efficacy and safety around the world. I'm excited for the future. FDA approval and Medicare coverage decisions are helping drive investment in new and different treatments, which will, in the coming years, deliver lower cost and more accessible medicines. The innovation starting gun we've seen in other areas like HIV, AIDS, and cancer is now beginning with Alzheimer's. Private sector companies, spurred by our own business collaborative for brain health, are focusing on the brain health of their employees, customers, and communities, and mitigate the risk of future Alzheimer's prevalence. Our relentless focus on equity will assure that America's underserved populations will get comparable diagnosis and treatment. And the prospect of Alzheimer's vaccines is now within sight, perhaps by the end of the decade. As Justice O'Connor said, we don't accomplish anything in this world alone. And I'm so glad you are here with us as we talk about how we work together to seize this moment to improve the lives of millions of Americans and make history by ending this terrible disease. Thank you.